So the demand this summer has been different to a usual year. Before the pandemic, we'd take maybe 5,500 909 calls into our control room every day, whereas across the summer we've been taking 6,000 and at points peaking up to around 7,000. That's comparable to a New Year's Eve for us in London, and that puts real pressure and demand on both our 909 call takers and our operational colleagues working on ambulances. That also has a knock-on effect to our support teams, the fleet operators, the VRC teams that look after our ambulance equipment. And so everyone's had to work that little bit harder to make sure we deliver care to London. So our challenge really this summer is that normally we'd see some busy days across the weekend, but every day's busy for us. And that means that for nearly 18 months now, our operational colleagues, both in our control rooms, our 111 call centres and on ambulances, haven't really been able to have respite or have downtime or have those quieter days where they can reset. And that's put pressure on our teams and it's meant that they're having to work every day twice as hard to support London. What's causing us challenges in terms of our increased demand is the community transmission rates for COVID-19, along with the roadmap out of lockdown where activity is returning to normal and certainly people are coming back out into London. And those two factors combined mean that we're seeing increased 909 calls and 111 calls into the service. So what we'd ask the public to do to help us to be able to help you is to use our services wisely by only calling 909 in a serious medical emergency. If it's urgent but not a serious medical emergency, we'd ask that you look at 111 online services in the first instance. That might direct you to a local pharmacist or another healthcare provider, or indeed to then call our 111 services for further assessment over the phone. So 111 can help you, especially on 111 online, by asking you a series of questions to understand your healthcare needs. If it's less urgent, you may be directed to an urgent care treatment centre, a pharmacy or a GP. And they may also take you through a telephone assessment to understand your healthcare needs. If, for example, it's less urgent but you do need to attend an emergency apartment, they may be able to book you a time slot so you can attend and see one of the practitioners almost straight away. If you have needed to call 999, only call us back if the patient's condition has changed or you no longer require the ambulance. Please don't call us asking for when the ambulance is expected to arrive, as that may delay someone else who is trying to call 999 to access help. It's been a really busy 18 months for our colleagues across the London Ambulance Service, and it's been an even busier summer. It's with my thanks to all of our colleagues and staff and volunteers across the London Ambulance Service for their flexibility and commitment to support delivering healthcare to the people of London.